So our research focused on and looked at the impact of attentional focus strategy on performance in recreational runners. So our team of researchers included board certified DPT Angie Huber and David Veerhoff. Additionally, it included University of Findlay student physical therapists Ashley Rings, Aaron Overheiser, Alex Matthews, Daniel Calcaterra, and Jack Berg. This is the poster presentation that goes along with our research and all of the information that will be presented in this presentation today.
So regarding purpose and significance of this study, other studies have shown that athletes participating in endurance sports seem to benefit from external attentional focus intervention compared to internal focus intervention. The purpose of this study was to determine whether internal or external attentional focus strategies altered the performance of recreational runners' heart rate, rating of perceived exertion, distance ran, spatial temporal variables, kinematics, and/or their individual psychology. This study was significant for recreational runners, endurance athletes, coaches, clinicians, and educators. So defining attentional focus, in terms of external focus strategies, we define external focus as where the performer's attention is directed to the effect of the action. External cueing was defined as a cue given to a runner to focus their attention to their action and the effect of the surrounding environment. Cueing a basketball player to focus on the hoop when shooting a basketball would be a great example of this. Internal focus strategies, defined as where the performer's attention is directed to the action itself, and internal cueing, defined as a cue given to a runner to direct their attention to the action that the body is performing, with a great example of cueing a basketball player to focus their attention on their follow-through during the shooting motion.
So the participants in our study consisted of 58 injury-free adult subjects, 37 males and 21 females, were randomly divided into an external and an internal focus strategy group via a double-blind fashion. There were 29 participants in each group, consisting of the internal and external focus strategies. Participants were required to have a regular running history of at least 3 months, and the average age of our participants was 27.1 years old, and that age range was from 18 to 65, with an average height of 175.8 centimeters, average weight of 72.4 kilograms, and an average BMI of 23.2 kilograms per meter squared.
So here's our methods for our study. Upon arriving to the testing site, each participant was outfitted with a wireless headset, a heart rate monitor, and 8 kinematic sensors placed throughout their lower body. Prior to the run, participants were educated on the Cooper 12-minute run test, which is the test that we had all of them do. And participants were also educated on the rating of perceived exertion scale, or RPE scale, and how to communicate to researchers when asked. After a brief warm-up, each participant completed a Cooper 12-minute run in an indoor track. During the run, participants received an internally or externally focused cue every 30 seconds with a reminder cue at 15 seconds between each cue. At the 6 and 11-minute marks during the run, researchers assessed their RPE of the participant on a Borg 10 scale. Following the 12-minute run, participants filled out a physical activity affect scale to assess their psychological variables. And right here, you guys can see the 4 internal and externally focused cues that we used throughout the study. An example of an internally focused cue was focus your arms swinging at your waist level, which is an internally active self-regulating cue. And then an example of an externally focused cue was focus on your arms cutting through the air, which is an externally active self-regulating cue. And here are the RPE and physical activity affect scales. So the RPE scale, we had a poster, and at the 6 and 11-minute mark, we held this poster in front of the participants while they were running, and they could have either shown with their fingers how hard they thought they were working, or they could have just told us a number, and that would be the RPE that we would record. And then for the physical activity affect scale, we had them go back to the starting point and fill out this affect scale before cooling down just to get their psychological variables.
So upon completion of our data collection, we performed Mann-Whitney U-test to analyze the groups for each variable, looking at significant differences, with significant differences being marked with a p being less than 0.05. After review, there were no significant differences found for heart rate, RPE, distance ran, cadence, stance duration, vertical excursion, or any of the other kinematic variables between the internal and external focus groups. There was a significant difference found between groups for the physical activity affect scale scores, with a higher negative affect found within the external focus group, which you can see at that bottom right box plot. And there was a positive trend found for the internal group to have a improved positive affect, as seen with the top graph on the right.
So then moving into our conclusions, some conclusions that were made from our results and research included that internal cueing may be more favorable compared to external focus for aiding in a favorable affect of recreational runners. Additionally, both external and internal attentional focus cueing does not appear to affect a runner's performance regarding spatiotemporal and kinematic variables. So looking at some limitations to our research was completed in an uncontrolled environment with a lot of background noise. Therefore, it could have affected the participants' focus on the cueing. So in future research, having a controlled setting may allow these participants to fully focus on their cueing that they are receiving. Additionally, it has been shown that runners are more likely to experience cognitive drift with continuous activities rather than task-specific activities. Since this specific research looked at the continuous activity of running, our participants were more likely to experience this cognitive drift. Finally, during our study, we used the Neuraxon IMUs to measure spatial-temporal and kinematic variables, and these are not considered the gold standard for measuring these two variables. So in order to get better overall data collection, researchers could use the gold standard devices. And then finally, the overall main clinical relevance of our study was that if patients or even runners are struggling with mental blocks or outlook on running, changing their focus to internal factors would be more beneficial than having them focus on external factors. Again, this is just a reminder in our poster presentation for all the information that we covered today in this presentation and throughout our research. We thank you for taking the time for coming to our presentation and listening to us here today.